Can you let me know if you can see my slides okay? Okay, perfect. Well, welcome everyone. Again, my name is Dr. Maurya Cockrell, and I'm super excited to talk about Elderspeak. The title of today's session is Nurture with Your Words and Get Your Elderspeak in Check. It's a topic that I'm extremely passionate about. You may have attended a voice session in the past, but hopefully this will be a refresher if you have. And if this is your first time, I look forward to kind of hearing your feedback and your thoughts on Elderspeak. So just thinking about elder speak and the purpose of today is to focus on having those compassionate conversations and being mindful of your words. So for today's agenda, I'll tell you a little bit more about who I am, my philosophy, just give you my lens and my point of view. Then I'll go into what exactly is elder speak. I'll give you some examples, pose a little few questions to the audience. Just look at elder speak as a form of ageism, then again, look at the relationship between elder speak and ageism as it relates to the social determinants of health. And then I want to share some positive strategies that you can try when you have those, intergenerational conversations and those conversations with aging adults. And then I'll close it again with some of my values and philosophy that hopefully you relate to. So again, who am I and what is my philosophy? As you heard, I founded Leave Speak Healthcare to focus on bridging the generational divide and improving those healthcare experiences between not only providers and patients, but patients, your family members, and your loved ones. And I just want to acknowledge that I'm so passionate about working with older adults because Leave Speak was founded just based on my relationship and experiences with my grandparents. Fun fact, today is my pawpaw's birthday. He would have been 104 years old. He passed away from Alzheimer's when I was younger, so definitely keep him in mind when I'm doing my work and focus on my Mimi, her experience in the healthcare system, and unfortunately, experiencing elder speak is really what motivated me to do this research, to do these workshops and webinars. So just keeping their memories in mind kind of as I do today's presentation. So as it was mentioned, I am an elder and death doula. So I help individuals and families navigate the aging process and also deal with grief and end of life choices. So it's non-medical care, more educational, just community support, being there bedside, helping plan final wishes, looking at legacy projects. So that is something that I definitely enjoy doing, just being with people in their difficult moments, but also SDOH solutionary. So I love looking at a broader lens, seeing how individuals, living environment, social community can impact their health outcomes. And that's something we'll get into a little bit later. But those are the two kind of point of views I'm coming from today. Just thinking about my philosophy and my values, definitely compassionate communication. We'll get into how important not using ageist language like elder speak is to health outcomes, but just communicating with care. It doesn't matter, if you are speaking to an older adult, but just having community and passionate communication with your loved ones, your friends, those in your community, or even your workplace. Focus on empowerment. A lot of times, and I'll get into that with elder speak, can disempower older adults. So want to make sure that we empower individuals to make their informed choices, have that respect and dignity in the healthcare system and in the community, and look at healthcare as a holistic point of view. And that's how we get into the social determinants of health. But also have that cultural sensitivity, just to be mindful that our lens and our background is not the same, it's not shared with everyone else. So having that element, I could also add a curiosity to make sure that you're learning not only about people, but learning with them as we kind of navigate this life together. So looking at what exactly is elder speak. So elder speak really comes from a place that's usually not intended to be ageist or stereotypical. It can come from a good place of care, but there can be negative impacts on one's emotional well-being. It can impact their health care. And as you see on the screen, it's really that patronizing communication style that's typically used with older adults that sounds like baby talk. So there are four categories of elder speak. The first one is diminutives, and as you see on the screen, those can be terms like honey, sweetie, dear, baby. Now, I am mindful that, sometimes when you're in like a romantic relationship or you're talking to a child, you can use those terms, but think about the lens of elder speak. When you notice your communication style is different than it would be if you were talking to like a friend or someone of the same age or someone in the workplace. The second category is collective pronoun usage. So that's when you're using we instead of you, using things like they. So we'll get into definitely some more examples of elder speak. The third category are tag questions. So it's when you ask a question, but you're really looking for a response. When you add, aren't you ready for bed? Or, aren't you tired? Just really giving that example of the answer that you would like. And the last category, reflective statements. And that's when there is a request that's usually framed to satisfy the provider or the individual making the statement and not necessarily the older adult. So just wanting to have a little bit of interaction. If you heard the question, how's my little sweetheart today? Can you put in the chat which category you feel that would fall into? Everyone a moment. Okay. See diminutives. Yeah, perfect. Yes, that is a diminutive because you hear not only the sweetheart, but a little sweetheart. Another example is, are we ready for our walk? What category do you pick up on? Again, are we ready for our walk? Yeah. Collective pronoun usage. And then just one more. You're feeling tired, aren't you? You can also kind of pay attention to the tone when someone's asking that. I see tag in the comments. Yeah, sounds good. So let me know, have you heard of Elderspeak before? Are you familiar with these four categories? And a lot of research actually is done in the long-term care setting. A lot of times just looking at the communication between workers and residents. That's where a lot of elder speak was noticed, but it's not only in healthcare, it can happen in other community settings, which we'll get into a little bit later. But my own personal research was looking at it in the health education field and noticing that elder speak was evident even when students were talking to standardized patients, not even in the live clinical environment. So definitely is something to be mindful of. Mhm. So I'll get into some examples of elder speak. You're already doing so great. I see in the chat you heard in long-term care with your mom and others. Yes, and that's why I love that Voice is having this education so we can kind of spread that awareness and also empower, adults to speak up and educate people on how they would like to be spoken to and what elder speak is. So starting off in the healthcare setting, looking at the four categories, I have some examples up there. How's my little patient today would fall into diminutives. Looking at collective pronoun usage, are we ready for our checkup? A tag question could be, you're feeling okay, aren't you? Maybe a provider is asking this, after a procedure or giving out new medication. And you can tell that the provider kind of wants to hear that the person is feeling okay or possibly feeling better. And then a reflective statement, can you lie down for me? And that is one when I did my research that I heard a lot of, and it was noted instead of just asking, can you lie down? So when there is elder speak in the healthcare environment, it can really undermine the trust and empowerment between the patient and the healthcare provider. Research shows that when you have that respectful communication, that can increase patient engagement and health outcomes. And when using elder speak, that can have a negative impact. And it might feel like the person is belittled. They might be a little reluctant from reaching out for medical attention. So it's very important to be mindful of it. Some other examples could be, are we taking our medicine today? You know, if you hear, are we taking our medicine today? What category do you feel like that would fall into? Also see in the chat, Jack shared diminutive sound belittling to me when speaking, to an elderly person or discounting their maturity. Yes, sometimes, using the phrases and language, it should, make you cringe just a little bit because you have to think about, would you say this again to your family member, to your friend, to your coworker? And it's just stopping yourself and pausing kind of before you notice you're changing your tone or your language to someone who is older. And yes, in the chat, that would be collective. Are we taking our medicine today? So I want us to think about elder speak in other settings outside of healthcare. So now let's look at the educational setting. And this is important because learning is lifelong. There's no age limit on going back to school, whether formal education or professional development. So having the mindset of being in the educational environment, a diminutive could be, okay, dear, let's get started with the lesson. So maybe you are in a community college class that's going over some professional development, maybe photography or something like that with a multi-generational classroom, and you're singling out an older person and kind of using that language, dear, sweetie, hun. Hun, are you ready for the lesson yet? Collective pronoun usage could also look like, are we ready to learn? Now, again, this is coming from the educator. So that educator is already aware and knows what the topic is. So thinking about, are you ready to learn? Are you ready for the topic? Tag question would be, you're following along, right? And when you hear that, it could make someone who maybe is a little lost or who has questions a little apprehensive of raising their hand and saying, I need assistance, because the tag question shows that the educator is already assuming that they got it. They're following along. And again, it doesn't just matter to someone who's older. There could be anyone of any age in that classroom that could be lost. And a reflective statement could be, can you write this down for me? And it seems so simple, but it's the for me at the end that really makes it the elder speak and that reflective statement, because when you look at it, it's honestly, not necessary. So put yourself in the mind frame of an older adult that is going back to school to learn new skills, someone that's super excited, maybe picking up another degree, like I said, taking a local class, and you start to hear this elder speak that can sound patronizing. And in order to have, engagement and great learning outcomes, those students have to have respectful interactions with the educators. And you also have to think about the impact that this would have on that older adult in the learning environment with others in the classroom. So their classmates, their colleagues, it could take away a little bit of respect and dignity. And it's important when thinking about the educational setting to treat all students of all ages the same and not single out someone because, they might appear to be older. So just another couple of examples. If you hear, you're doing great, aren't you? What category would that fall into? That question. I feel like there are some elder speak experts here and excited for you all to kind of share this information. Because again, it seems so simple, but because it seems simple, that's why we have to be mindful of our communication with others. So let's take a look at the social settings. Social settings could be, whether it's a community choir group or your church setting, maybe a volunteer group, those that are kind of voluntary where you can come together, be with your friends in that environment, or it could also be maybe group-led activities, retreats and things of that nature. So any type of setting where you feel like you're networking and connecting with others, that's really what we're looking at right now. So diminutive could be, welcome, sweetie, to our group. So excited to have you here. And again, the intention does not sound bad. The intention is good, making someone feel welcome. But again, it's adding the sweetie. And in any communication, it's always great to ask someone, what is their preferred name? Just having that element of respect is helpful. So it's when you're injecting sweetie, honey, dear, cutie pie, grandpa, without asking if, that's that person's nickname or if they're okay with that. Collective pronoun usage could sound like, are we enjoying the event? Now, again, I know I'm having a good time at the event. Now I want to check with you. Are you having a good time? Is there anything you need? Because maybe that person isn't having enough fun. Maybe they want to leave, but because they feel like you're enjoying it, they might feel pressured to not speak up and say, actually, I would prefer to go bowling instead, or something like that. For tag questions, similar, you're having fun, aren't you? Now, if someone asks you that and maybe they're the host of an event and you're not having fun, it could get a little awkward for you to say, no, and I'm actually ready to go home. You'd really want to remove that element of pressure to respond by kind of just inputting and influencing the person's response based on what you want to hear. And then the reflective statement could be, can you join us here for me? Maybe it's join us over here at the table, join us at the restaurant. But again, it's that for me that adds the element of elder speak because again, you're giving that person the choice. Do you want to join me? Do you want to sit here? And the for me is unnecessary. So like I said, these social communities can be churches or community centers. It's places that usually we just agree to meet up and connect. And because we are choosing these spaces, maybe not our workforce or in our family home, something that, we did not create the people that we're born into or the people that we work with, when we go into the social community, that's supposed to be our chance to really be free, be who we are. And so if elder speak is introduced, again, that can take away the feeling of inclusion or respect. And that can make someone feel, undervalued or unwelcome, and most likely maybe not return to that social situation. So having that respectful communication is really important to enhance participation. So think about if you are starting a networking group or you're wanting to bridge these generational gaps and have people of all ages coming to your events, it's definitely something to think about because you want individuals of all ages to feel that they're respected and that they have a sense of belonging. And it's good to kind of model that behavior. That way, others in that social setting know the importance of respectful communication. Any thoughts or questions? I know primarily elder speak has been documented in research in the healthcare setting, but have you heard any elders speak so far in your educational setting or even in your social community? You can put it in the chat if you've experienced it or maybe you've witnessed it. Give a moment. Thank you all for participating so far. I appreciate it. And if you're typing, you can still feel free to share in the chat. Next, want to look at environmental settings. So when thinking of the environment, this could be like assisted living communities where you have to have that dignity and independence. I see Yvonne, you put in the chat that yes, you have heard it. Jack said in memory care, for Alzheimer's, your sweetie honey talk often. Do you feel Alzheimer patients can even feel patronized? That really depends on the individual and most likely their stage, but it's always just important to know, even if cognitively they might not be aware, just knowing, from your perspective, what's respectful communication and using that as a healthcare professional in those settings is important because you just never know the impact of the words. And maybe it might not seem like it's bothering someone or that they can feel it. There can still be, just those impacts, or maybe they don't feel comfortable speaking up. And also being mindful of the loved ones who are coming to visit those individuals and residents in those settings, that can be disheartening and a little uh, just frustrating to hear as a family member if you walk in and you hear that elder speak. So like I said, my personal experience with my grandparents, not having the elder speak directed at me, but witnessing it and the impact is something that we need to be mindful of. I also see in the chat, in the social community setting, driving up to the window using dear. What can I get you, dear? Yes, definitely their grocery store, common to hear that as well. So in the environment setting, you might be thinking of community living, maybe apartments, condos, or even kind of in outside of the park, just out in your kind of built and living environment. You might hear diminutives, let's get you all comfy, dear. You can ask, are you comfortable? Do you need a pillow? There are so many different ways to kind of phrase that communication. Then collective pronoun usage, are we ready to go outside? Maybe go for a walk, enjoy the summer weather. But again, it's, are you ready to go outside? Or maybe would you like to join me outside? Or some other ways of reframing it. I see in the chat, been on the receiving end of elder speaks in social situations. Tag questions, you're feeling warm, aren't you? Well, maybe just because I'm feeling warm doesn't mean the person next to me is feeling warm. So again, important to check in. And all of this is based on just those assumptions and having those preferred responses instead of checking to see how the individual is thinking, feeling, and noting what they want to do. And then reflective statements. Can you sit over here for me? Again, maybe they don't want to sit there. Maybe they have a favorite chair and now they feel pressured. Okay, let me go over here. Let me sit with this person for a while. I want to make them happy, just thinking about potentially residents and, senior living community. Maybe there could be some fear of retaliation, or what if I don't sit over here with this person? Or what if I don't do XYZ for this provider, this worker? What is the impact? And we definitely, don't want residents, patients to experience that. So again, research really shows that respectful language can promote autonomy and well-being for older adults in those long-term care settings. And when you are in different caregiving environments, it's so important to understand the impact of the communication, again, not only for the well-being of older adults, but like I was mentioning to Jack's comment, hearing that as a relative, as a friend, there's an impact as well. I see in the chat, how do you say I don't want to sit there in a nice way? You could say, I prefer to sit over here, but maybe tomorrow or maybe the next time we meet, we can sit together at this event, or I'm comfortable right now. I really prefer not to move. Just different ways instead of, you don't have to say, no, I don't want to sit by you or anything like that, but just make it known that you're comfortable, you're happy where you are. And that's fine. That's why we want to have that empowerment to make your choice known, and doesn't mean to be rude or disrespectful. But when people are using elder speak to you, that's disrespectful in itself. So it definitely goes both ways to have that great communication and great relationship with those in your community. Let's see. No problem. So now looking at elder speak in economic settings. So when thinking of economic settings right now, maybe like banks, that's what I'm thinking about, where there is shopping or exchange of money or resources. So just thinking about at the bank, a diminutive could be, here's your change, sweetie. If I went to the bank right now, maybe appearing to be a millennial, I don't think I would get the sweetie, the honey, the dear. But I will make note that it is important to know in southern states or maybe in different parts of the country or world, there are those dialects and phrases that people might use. So again, most times the intention is not to harm someone, but the impact can be harmful. And that's why we just need to be mindful of the communication. Collective pronoun usage could be, are we ready to check out? Again, you're thinking of that shopping exchange. The person who's saying this is most likely the cashier. So I should be asking you, are you ready to check out? Is there anything else you need? Because we aren't checking out together. As the cashier, I'm not paying for the items, you are. So that's why it's important not to use that collective pronoun usage. Tag question could be thinking about in the grocery store. You're sure that's all you need, right? This can make someone feel like, well, I already asked, what aisle is this in? Or I asked someone to help me reach this jar on the top shelf. Like, am I bothering this person? I really need, two more things, but now I feel like I can't ask them. And that's not, the reaction that we want to have. So it's important to think about those tag questions. And then reflect a statement. Can you sign this for me? So think about going to the bank, opening up a new account, and you have to sign all the forms, all the paperwork. Again, this is for you. This is your account. I shouldn't be asking you to sign anything for me. You should empower the person to read the full agreement, the terms and conditions, and if they feel comfortable, then move forward with signing. So you want, older adults to feel comfortable in these situations, financial institutions, at the store, and it can negatively impact customer satisfaction if they are met with elder speak. So you want to treat everyone, as their client with respect, regardless of their age, and making sure that they do feel valued and confident when handling financial matters. So just wanted to know, have you heard or witnessed any elders speak in maybe your environment, out at the park, or even at the bank or grocery store? And you can put in the chat if you have. Yeah, I see, yes. Un- Unfortunately, it seems like a shared experience of elder speak in all of these settings. So now I just want to talk quickly about elder speak as a form of ageism. So, understanding ageism, that it's discrimination based on an individual's chronological age, and just being mindful of statistics, by 2060, nearly 1 in 4 Americans will be age 65 and older. So, our population is growing and aging, and that's why it's so important to just keep respectful communication in mind. So thinking about the impact, like I mentioned, on healthcare, maybe not adhering to medical advice, that can lead to social isolation, maybe economic stability if they're met with elder speak in the workforce and not feeling comfortable or valued, and also some poor health outcomes. So it's that elder speak is a subtle way of using ageism that reinforces those negative stereotypes. Again, it sounds simple, like for me and right and we instead of you, but it is a form of ageism that really can be damaging and can start manifesting into everyday interactions. Sometimes, it's related to, microaggressions when people hear, oh, there are these little frustrating words, someone talking about, you sound educated or something about your hair and it seems small, but if you hear this over and over and over, that can have damaging impacts. So again, like I said, it's subtle, but it can reinforce that negative stereotype and behavior, treating adults like they're children and incompetent, which is not something that we want to do. And it can have that impact on self-esteem and allowing someone to feel independent. You don't want anyone questioning, their competency or if they're able to handle banking information or able to go to the store and things like themselves. You want to empower older adults to just take charge of their life, but also if they need help, feel comfortable asking and not like that they're bothering someone. So when thinking about ageism and elder speak, are there any ways, just right off the bat, that you feel like individuals can kind of combat it? Maybe if someone is using elder speak to you, something you might be able to say, or if you witness your loved one or a friend experiencing elder speak, how you might be able to reframe it or educate someone about it. You can share in the chat if you would like, or just any thoughts about ageism and elder speak, if this is your first time hearing about it. So just want to again talk about elder speak as a social determinant of health because again, looking at all the different ways that interactions, your living situation, your social community can impact your health outcomes and that impacts your overall quality of life. It's important to really understand that relationship. And I don't know if you noticed, but when I gave examples of each form of elder speak, well, the different categories in various settings, I was really mirroring it off of the 5 social determinants of health. So again, looking at the economic stability, it can reduce an older adult's ability to work or manage finances, maybe because someone heard so much elder speak, or are you sure? Is there anything we can do to look over your finances? They might start questioning, well, can I manage this independently? Do I need help? And can start to withdraw. In education, again, if someone feels discriminated against, or if they're in the classroom and they're being singled out because of their chronological age, that can impact lifelong learning. That could be a dream deferred where someone doesn't feel comfortable going back to school to get a degree or to learn photography because they might not fit into the stereotypical student or that age group. So we don't want to impact someone's ability to learn and upskill themselves. In healthcare, like we already discussed, it can impact adherence to medical advice. Maybe a provider is well-intentioned, wanting someone to get the right care and treatment, but using the condescending tone and saying honey or sweetie or my little patient, that can make someone not want to listen to that provider, maybe not listen to the referral or their advice. So it can have those consequences. And again, it can impact health literacy. If they already feel that someone is talking down to them or treating them like a child, and they have questions about the medical instructions or the prescription, they might not feel comfortable speaking up, asking for clarification. And then looking at the neighborhood and built environment, it can lead to social withdrawal or isolation. Maybe, someone is in that long-term care community and workers using Elderspeak, like, oh, are we ready to go outside? Are we ready for a walk? And it's frustrating that maybe they say, I just want to stay in my room. I don't want to have these interactions, or someone's starting to question their ability to make sound decisions that could impact their safety and access to community resources. And the last one, like we discussed, the social and community aspect. It can, reduce participation, leading to isolation. And one of the social communities is churches, and being mindful of how there are more mega churches with multi-generational populations. It's important to know as maybe younger generations come and get involved and their population grows in that community, that they aren't singling out others or making them feel unwelcome. That can lead to isolation and withdrawal from activities that these older adults once loved. So just thinking about whether yourself or those in your community, how do you feel like elder speak and ageism can impact the different areas that you work in, you live in, or your social activities? Like if you were in one of these settings and you had this experience, do you feel like you would go back? Or how would that kind of impact your view of that person or that organization? And if you want, you can share in the chat again. I appreciate all the engagement. And again, just seeing that your attendees have experienced elder speak is definitely frustrating. It shows the importance of having these conversations in education because, when you're met with that, or again, if you witness that, it's really an educational moment. Because like I said, most times someone is not intentionally trying to be offensive or harmful. They just don't know that there are true documented impacts, and even having a conversation with someone of a different generation can highlight those negative impacts of elder speak. So again, respectful communication isn't just about being nice or about being polite. It's really crucial for everyone's overall well-being. It's crucial for our society to have great intergenerational relationships. And we just have to think about how communication, which seems simple, can truly impact our outcomes. I see in the chat a comment. My own children made me feel belittled when I told them I was enrolling in how to use a Facebook class. They laughed, saying anyone can figure it out. I I don't like hearing that, and I'm sorry, especially when it's like your own family. And again, not thinking anything of it. I'm sure they weren't trying to be harmful, but when you hear that, it can make you, or even if I heard that, say, well, why can't I figure it out? Like, is it bad that I want to have this book and I want to learn? But the thing is, even someone of a younger generation, whether millennial, Gen Alpha, Gen Z, there's still so many different nuances about social media that a class would be great. And even when you get to that class, you might see a lot of people of your generation, older or younger, all trying to learn. And it's important not to make someone feel belittled when trying to, like I said, upskill themselves, learn a new skill. And again, it's education. And as you kind of have these interactions with your family, your community, then you can kind of nicely educate them. Okay, good. You took the class anyway and block them. Hey, gotta love the block feature, mute. And, if people aren't respecting your boundaries or having respectful communication, social media does have some great features to make sure that you limit that interaction. I also see in the chat could definitely impact self-esteem and limit participation. Yes, because you want to feel like you're included, you're involved in this setting. So we have to be. Oh, I also see unblock them shortly. Just letting them know that they're on probation period, close watch, to make sure they use respectful communication in the future. So just want to touch on again social determinants of health broadly with ageism. Just knowing that we saw 1 in 4 in 2060 will be age 65 and older, but also knowing that approximately 10,000 Americans turn 65 each day, we have to start thinking about the number of people in our community, in our society, that could be on the receiving end of Elderspeak and ageist practices. So it's something to think about when we're looking at different partnerships, or whether it's long-term care or these different settings, that we aren't creating silos. Again, because ageism isn't just in healthcare, we see it in the workforce. Those who maybe they got laid off later in life trying to re-enter, maybe needing assistance with a resume or applying through LinkedIn, all these new formats. There can be these negative impacts if we have this breakdown in communication and respect with different generations. So we need to have that relationship and bond not only with individuals, but organizations, corporate partners, public health, and our own social communities. So thinking about the 5 areas again, ageism can impact, all of these areas. And just a reminder of the 5 domains: the economic stability, that's the impact to employment, your food security, being able to live in a place as it relates to a built environment where there's grocery stores and not in a food desert. Impact to housing and poverty, thinking about not only health literacy, but general literacy, graduation metrics, access to higher education, access to health insurance, understanding health insurance and benefit, like I said, the quality of housing, transportation, these social networks. And the thing is, these are all different kind of categories that can impact your health care. So, not having the transportation to get to the doctor can impact your health come. Living in a food desert and not having access to fruits and vegetables can definitely impact, your lifespan. Not being able to have access to education or literacy. Maybe, someone is not able to understand the terms and conditions at the bank. So it's important to kind of think of all these and keep it in mind when people are going through health struggles, whether someone you know or yourself. You have to think that there's so much that impacts healthcare outside of that one interaction between a patient and a provider. So when thinking about it with ageism, it could limit job opportunities. Like I said, think of someone who was recently laid off later in life. Maybe now when they interview, there's a barrier and they are not being able to communicate with recruiters easily. A lot of interviews are virtual now. So if there is some ageism or not acceptance, or at least resources to help individuals of all ages apply to jobs, that can lead to financial insecurity. Thinking again of in the educational environment, creating a reluctancy to go back to school, to take a class, to pick up a book, to learn something new, because there could be that judgment that comes along with it. Again, making sure someone doesn't have inadequate care because maybe they went to the doctor and there was ageist behaviors. Just thinking back to, again, my Mimi, not only was it elder speak, she was told that she had lived her number of years that she was allotted, and was told not to pursue chemotherapy and radiation. So she wasn't getting the adequate care from that provider because her wishes, were not the same as the healthcare provider. So maybe think about someone who's in that situation that maybe doesn't have access to other healthcare systems, and that's the one provider that can lead to inadequate care and poor health outcomes. There can also be living in unsafe living environment or lack of access to services that we have to be mindful of. And you can start to think about the programming and policies that can impact all of these social determinants, and making sure that not only are individuals cared for and they have that healthcare and needs, but everyone's thriving and happy. It's not enough just to survive and be alive. We want individuals of all ages to engage, to make friends, and to really just enjoy their years. So I came up with a few strategies. Like I said, research Elderspeak some years ago, and it's great to kind of educate on the issues and the problems. But I wanted to start reframing, what can we do? Like, what are some resources and strategies to empower not only ourselves, but older adults in our communities? And so we'll go over just a few. The concept, co-generative communication for collaborative care. And it's really coming together, again, thinking about intergenerational conversations and relationships. So relationships between individuals of different generations coming together to really co-create and co-design what the healthcare can look like. So it's that respectful, empowering communication that really leads to autonomy and mutual respect, not only between caregivers and older adults, but friends, patients, providers, residents, and workers. So it's a framework just to keep that in mind, that we should be going into each setting, looking at how we can work together, not me being in a position of being a provider or educator telling you what to do, but making sure your wishes are valued as well. So think about these two frameworks. Always seek out wisdom. Earlier, I mentioned having the element of curiosity to learn about people and to learn with them. But when you seek out wisdom, you're actively listening to understand that older adult's perspective. You're reaching out with empathy and respect, and you're valuing the knowledge and experience, because it is a blessing to age and get older. So as someone ages, they have that experience, the wisdom, and it's great to acknowledge that. And then just going back to being mindful of what you put out there in the universe, the respectful communication that comes back. I'll show you in the next couple of slides how to use REAP as a way to combat elder speak and really reframe the language. So we're looking at respect, educating, autonomize, making sure people know that they are empowered to make decisions, and pilot, maybe give examples of different situations instead of telling someone what to do. So when thinking about healthcare, again, we went through the examples of elder speak. So how's my little patient today? The respectful way would be, Mrs. Smith, how are you feeling today? Collective pronoun, are we ready for our checkup? Mrs. Smith, it's time for your checkup. Informing that person. A tag question, you're feeling okay, aren't you? That can be changed and say, Mrs. Smith, can you tell me how you're feeling? Making sure they feel that way to be respectful, to speak up for what they want and how they feel. And then, can you lie down for me? Mrs. Smith, please lie down so that I can examine you comfortably. It's all about having the respect, the education, and really just using a few simple words, maybe taking back for me or right, and asking that person to share their perspective and how they feel. Looking at this in the educational setting, again, using the similar examples that we had previously, think about for diminutives instead, Mr. John, it's time to begin the lesson. Like it's time to get the class started, not using, okay, dear, again, using the preferred name, or just being respectful until you know that person's preferred nickname. Instead of, are we ready to learn? Okay, Mr. Johnson, today you will learn about this topic. Again, I'm taking the lens of the educator and I'm about to teach you. We're not learning together in this formal setting. The tag question, you're following along, right? Or you can ask, how are you following the lesson? Do you have any questions? Create that space where someone can speak up to ask questions if they have concerns. And then, can you write this down for me? Instead, please write this down to help with your understanding. Again, all of this is just helping with educating, having that respect, and making someone feel empowered to speak up if they have issues or just to share their opinion. The social setting. Instead of welcome, sweetie, to our group, Mrs. Taylor, welcome to our group. And then you can ask, okay, would you like to be known as Mrs. Taylor? Do you have a nickname that you like to use to make that person feel like they belong and that they feel comfortable? Instead of, are we enjoying the event? How are you enjoying the event? Are you ready to go? Do you have a different preferred activity? Again, you're having fun, aren't you? Are you enjoying yourself? Giving someone the space to breathe, to reflect, and really assess, are they enjoying themselves? Is there anything that they need? And then, can you join us here for me? please join us here if you're comfortable. And that goes back to in the chat, you could respond back and say, actually, I'm comfortable over here. Maybe next time we can sit together. Or, maybe in a few minutes, I'd rather not move right now. But it's giving that person the space to kind of speak up and be empowered. In the environmental setting, instead of saying, let's get you all comfy, are you comfortable? Maybe the chair is uncomfortable to you and you need a pillow, but Mr. Green could be just fine. Collective pronoun usage, would you like to go outside and get some air instead of are we ready to go outside? Maybe again, are you feeling warm? Are you feeling warm? Would you like a blanket? Again, just because I feel this way does not mean that this older adult feels the same way. And then asking, can you sit over here? Please sit wherever it's comfortable. Just giving them the option. Last, just looking at it again in the economic setting is, looking at Mrs. Lee, here's your change. No, sweetie, using the first name, well, the last name, until you're on that kind of first name basis or again, the nickname. Are you ready to check out? Again, if I'm thinking with the mindset of the cashier, you're the person paying. It's not we, it's are you ready? Do you have everything that you need? Not making someone feel rushed or that they can't ask for help or assistance is important. And then asking, please sign here to complete your transaction, not sign this for me. So let me know in the chat if you feel like this is helpful. Maybe as you educate people, it's really just making sure that they understand respect, education, maybe show someone the desired behavior activity and then allowing them to make the decision for themselves instead of making someone feel like they have to do something for you in the way that you prefer. And this really ties in, like I said, back to the values of being an elder and death doula, helping people navigate, the different areas of life and social determinants, because it goes back to having that compassionate communication that's important for end of life and healthy aging. That empowerment of all ages to know that you are able to make your own decisions. And when it gets to the point that maybe you need some assistance, it's okay to reach out and ask for help. And then to have that respect and know that there's so many other factors that can truly impact someone's overall health and well-being. So look at healthcare from a holistic point of view. Respect. And they always say treat someone how you prefer to be treated, but to ask them, what is their preference? How would you like to be treated? What would make you feel comfortable? Because you would want someone to do the same for you. To have empathy with every interaction. We never know what someone is going through, what they've been through, or what they might face in the future. So just to have that understanding and know that we only see a small portion of their life, and let's make that interaction as great as possible. To educate. Coming to the session, definitely appreciate it to learn more about Elderspeak, to have that refresher if you've been here before, but to also educate others if you witness it, to say, hey, there's a better way of saying that. That can actually make someone feel XYZ type of way. What if you tried reframing your question like this? And then to provide support. Maybe someone's coming to you and someone made a comment about their age and they're feeling down. Being able to be there for them, to remind them of their independence and dignity is extremely important. So with that, I just want to say thank you so much. I hope this session was informative, and I hope it just helps you feel more empowered if you have experienced Elderspeak, how to not only stand up for yourself, but to educate others on how you want to be treated. And hopefully when you think of Elderspeak, you'll now think of Sow and Reap and different ways to have that respect, education, autonomy, and pilot to teach people how to improve communication with you. And I know we have a few more minutes. I just wanted to see if anyone had any questions. Again, thank you so much for participating and sharing your experience and being vulnerable and, just treating today as a safe space to kind of learn together. Oh, someone asked about Leave Speak. So the name Leave Speak, dual purpose, because of my grandmother's experience with Elderspeak, I had the mindset of every time you kind of leave that encounter with a provider, that interaction that you have can speak to your relationship, your trust, your value with that individual in the system. But also, like I mentioned, as a death doula, just navigating people as they transition, sometimes say death, transition, or they're leaving kind of this formal body, knowing that their experience with you, the relationship will always speak to who they were, speak to the impact that they had on your life. So that was the name I came up with to kind of just honor those two aspects of the business. And that's how I developed Leaf Speak. Thank you so much.
All right. Thank you so much, Dr. Maurya Cockrell. That was so informative. We really appreciate you being here with us today. And let's see if I can share my screen again. We do just have some, I saw that too.
Jackson, what is your definition of a death doula? I am there to provide emotional support, educational support, and each death doula kind of has their area of focus. So some services that I offer could be sitting with someone, doing a life review, kind of reflecting on all the lessons learned, maybe their legacy and wishes that they want to pass down to loved ones or those in society, helping individuals make those end of life decisions. So being there, empowering them to make those decisions. Maybe it's about, formal end of life choices like cremation or burial. Maybe it's about not having a do not resuscitate, or how much medical care do you want at the end, and empowering them to make those decisions and then communicate that with their loved ones and also communicate that with their healthcare providers. But I can also assist with funeral planning, helping design obituaries and things of that nature. So everyone kind of offers services they feel like relate most to who they are and what they can bring to that individual. But just being by that person's side, having those uncomfortable moments. Sometimes people have choices and decisions that they're not ready to share with their family. Maybe they don't think they'll be heard or respected. And that's where I can come in, kind of be that liaison to be there with them as they share that information, to make sure they document it, to notify the correct individuals where that information is, but also sometimes working with families who are in the process of losing a loved one or recently have lost a loved one, to find different ways to kind of keep their memory alive and to honor them. So that's a little bit, but again, the primary thing that it's non-medical. We are a partner to healthcare providers, to hospice workers, to social workers, to lawyers and life insurance agents. So we are part of that end of life continuum, but really just to be there to educate, to support, and just provide that connection when it comes to that time of transition. I appreciate you asking that.
All right. Very informative, very good information. Thank you again so much.
You're welcome. Thank you for having me.
Of course.